Okay, so this is our footy lesson, lying on our backs and our sides. So lie on your backs, please. And since you will be on your side for portions of this lesson, you may want to pause the CD and prepare yourself with a pillow or maybe even folded towel, so it's a little firmer than just a soft, squishy pillow. This lesson you can support your head with your arm, so that's also an option for you. So lying on your backs, imagine if you were lying in the sand right now. What kind of imprint would your body make? How deep into the sand would the back of your head go? And when your neck curves away from the sand, at what exact point does your upper spine begin to make pressure into the sand? And again, how deep would that be? What shapes would your shoulder blades make? Your elbows, your left and right elbow, would they sink into the sand the same amount, or is one resting a little more lightly than the other? Feel the right side and the left side of the back of your ribs. Feel how the sand might support your lower back. Can your low back just relax into the support of the sand? Thinking about your pelvis. Again, feeling any differences that you can detect between the right and left sides. Your buttocks. And feel your legs. Bring your attention to your right leg, the weight of your right leg compared to the left. How long do each of your legs feel? Does one leg roll a little out so your toe is pointed more outward than your other toes? What about the weight through your heels? What about the backs of your knees? How do your knees rest? Your left knee and your right knee? And then slowly, one leg at a time, bend your knees up so that you're standing through your feet. And change your perspective so your feet are standing solidly through the floor, through your mat. And just check it out. How solid are your feet? Do your knees want to wobble to the side, out or in? Do they feel really secure in their position? And play with 2 or 3 different positions with your feet either closer or farther away from your buttocks, or wider or narrow. And each time you pick a new position, just feel. What is it to feel how I feel? And choose what feels right. How do we learn to trust our feelings again and not put so much faith in what we have learned, what we've been told, what other people say, but learn to really trust ourselves and our feelings? And just gently press down with both of your feet and relax. And do that several times, really feeling that the relationship of your feet to the floor as you press and as you release. What do your feet do to release the movement, causing them to press into the floor? And which part of your feet do you press with the most? More through the heels or the balls of your feet? The outside or the insides of your feet? And what's different between the right foot and the left foot? Which foot leads? Is there a slight head start that one side gets over the other side? Can you feel that one foot just barely initiates pressing before the other one? And is that the same foot, if you're able to detect that, is that the same foot that releases first? Or does your other foot release the pressure first? And notice each time you press, how is that pressure translated up through your legs, past your knees, right into your hips and pelvis? And can you feel the tendency for your pelvis to rock a little bit? As you press, your pelvis might rock back, flattening your low back towards the floor. Maybe not all the way to the floor, but there's just an inclination for the low back to come closer to the floor as the pelvis rolls as a result of the pressure through the feet. Just feel that. And again, feel how the whole of your lower body releases and comes back to neutral. And then let that go and just relax for a moment. Let your legs down if that's comfortable for you. And again, bend your knees up and then roll on to whichever side you choose. Resting your top leg on your bottom leg, and really taking care to make sure that your hips are at about 90 degrees. So your upper thigh is coming out from your trunk at about 90 degrees. And your knees are bent at about 90 degrees. And your top leg is fully resting on your bottom leg. And just feel the support that your bottom leg is offering. Notice which side you chose to roll to. I wonder why. Why this side? Is this the side you sleep on the most? Or the side you perceive has less pain? And bringing your attention down to your feet, try to be sure that your top heel is resting right on your bottom heel. And pivot so that you're bringing the ball of your foot up towards the ceiling, but your heels stay touching. So it's a little rotation in your lower leg so that your foot can come a little ways or a lot up to the ceiling and back down. There's no right amount of motion. Just experience keeping the heels touching, the top foot just lifting a little away from the bottom foot. And feel, is there any translation of that movement or the preparation of movement up your lower leg? What happens in your knee? Is there anything you can feel happening in your thigh? Bone to bone. So the lower leg would be your tibia and that little fibula bone on the outside. Your upper leg would be your femur, the longest bone in your body, connecting at the hip joint to the pelvis. And then just pause for a moment. And see what it's like now to pivot on the balls of your foot. So where the ball, where the big toe meets that part of the ball of your foot where some of you might have bunions, That stays touching, and you gently raise your heel up towards the ceiling. And how many parts of that movement can you detect? What happens in your foot even? Is there tension or effort or movement, muscle contractions that happen in your foot to help this movement? Where does the movement happen? What happens further up your leg, into your knee? From the bones of your lower leg and foot that are moving, is there any communication influencing any movement on up into your thigh, your pelvis? And then just a few times alternate, lifting the heel up and the ball of the foot up, and the heel and the ball of the foot. And just feeling that movement move through as much of you as you can feel. What happens if you make the movement really, really slow? Really, really small. Almost to the point that you're just feeling how to initiate the movement. How to make it start without maybe even doing a lot of movement, but you're feeling all the preparations for movement throughout your leg and other parts of your body. And then just rest that and roll onto your backs, please. And just feel. Feel what you sense in your right leg and your left leg. Is there more to notice that's different after having one leg support you on the floor while the other leg begins to explore these little movements? And then bend your knees up one at a time, please. Find a secure and comfortable position for your feet to rest with your knees bent. And just a couple times, press through your feet gently, feeling the sequence of movement. First the initiation of pressure, and then the actual pressure. And then the translation of that movement up your legs, into your hip joints. Rolling your pelvis back just a little, feeling the lower back come closer to the floor, and then piece by piece relaxing that movement, and really feeling how is your foot serving you? What part of your feet are you using? So do this a couple times, intentionally using your heels more. So that might be more familiar to you, or you might have to really configure your feet in a way to minimize the pressure through the balls of your feet. And when I say ball of your feet, I mean the whole of the foot, the whole width of the foot, from the big toe to the little foot, to the little toe. Some people think of the ball of the foot as just behind the big toe. And when I'm referring to it, I'm referring to the whole width of the front of the foot. And then press a few times, really focusing on just the ball of the foot. Pressing and releasing. And as you press through the ball of your foot, there are 5 distinct segments of the ball of the foot, each of them attached to one of your toes. So notice which part of the ball of your foot do you use the most? Do you press through the ball of the foot that's connected to the big toe, the great toe? You press evenly along the whole of the ball of the foot? Do you lift your inside arch and use more of the outside of the foot? Just notice. And then roll onto the same side again, please. Just feeling how your lower leg is supporting you. Feel the knee, the top knee resting on the bottom knee, and gently, slowly making the movement very small at first. So don't do a full movement until you've sort of grown your awareness into the full movement of pivoting on your knees so that you're raising your foot and your lower leg towards the ceiling and lowering it back down. And how does your bottom leg support this movement? If something's raising up, something else is pressing down. So how do you use the support of your body into the floor to make the foot that's raising towards the ceiling lighter and lighter, easier and more effortless? And again, what's happening in the rest of your leg? Is your foot just soft and relaxed going along for the ride? Or is there some sort of position that you are holding it in? Feel the rotation, the rolling of your top thigh on your lower thigh. And what does that communicate to your pelvis? What is your pelvis invited to do? Does it roll a little forward or backward each time your foot raises and lowers? Maybe you don't feel your pelvis so much rolling forward or backwards, but you feel your pelvis raising a little towards your shoulder on that side. You might feel movement in your spine and your ribs. Just notice how it's affecting your particular body in this unique moment. And then rest your foot on top of your other foot and begin to raise your knee up towards the ceiling, pivoting on your whole foot. As a physical therapy exercise, we call this the clamshell. And we're not doing it so much for the benefits of the strengthening, but to really feel how movements in the lower leg influence the pelvis, the low back, the ribs. And again, does your pelvis want to roll forward or back? Each time your knee raises up, it may be inviting the rest of your body to follow along. So if you just let go, where is your body being invited? In your hip joint, in your pelvis, in your spine and your ribs. And then rest a moment. Just feel your leg being supported by your other leg. If you're noticing any discomfort anywhere, do less movement. It's not about range of motion. It's not about making it burn. And now alternate. So first you raise your foot towards the ceiling, and then you raise your knee. And it's enough just to initiate movement without really having a distance being created from your foot or your knee to the floor. Just to begin to feel how the initiation, how the beginnings of that movement has influence in other parts of your body. Begins to redevelop the capacity of your nervous system to sense and feel and know your wholeness. And with time, when you ask yourself, how do I really feel about this? You know what feels easy, relaxed, appropriate, right in your body. And you can bypass all of the what do I think about this messages that all of the people in your life have tried to plant in your mind to help you become the right kind of person according to them. And when you've done that a few times, next time you bring your knee up, just keep taking it up and back and back and back, and see if you can let the opening of your knee one from the other to help you roll onto your back and take a full rest. And feel now, what's changing? Is anything changing? And what's the point of having something change or not change? What's the point of resting when you're not breathing hard and your muscles aren't warmed up and you're not sweating? How does a human nervous system learn? Does it learn by repetition, repeating, repeating, repeating? Some things are learned that way. But if we're really wanting to learn to come into ourselves, to live our most authentic life, that's a felt sensation. It stems from our natural human curiosity, adventurousness, desire to explore. How curious can we become about how we live in these bodies so that we can take better and better care of them, so that they will last longer for us, more happily for us, and we can squeeze every bit of juicy life out of this experience. So bend your knees up one at a time again, please. And gently begin pressing and releasing through your feet. And each time you press, follow with the actual sensation or your imagination, how that pressure travels up, communicates up, not just through your pelvis and your low back, but through each of the 24 vertebrae of your spine. Each time you press, what sensations might become available as a result of that pressure in your mid-back, in your upper back and neck, in your head, your shoulder blades. And again, feel those sensations as you let go. Is it sequential in the same way? As one presses up, for my own experience, I can feel it very sequentially from my feet to my pelvis, through the vertebrae in my spine, many of which I imagine, up to my head. And is it the same as you release? Does it go head first, neck, mid-back, low back? Or is there a different sequence that your particular way of sensing experiences? And again, notice which part of your feet are you using? More the heels or the ball of your foot? And once again, bring more attention to the ball of your foot. And notice where you tend to put more pressure, what's your natural habit. And I want you to intentionally press and release just once or twice, with your intention being that you're pressing and releasing through the ball of the foot that's immediately behind your great toe. And just press and release, and just ask yourself what that feels like. Is that familiar? Is that a new experience? How does the rest of your body receive that information? And then go to the ball of the foot just behind your second toe. And eventually your third, fourth, and fifth toe. But take your time and see if you can feel the very minute differences. What happens in your lower leg? Maybe even into your hip and pelvis as you press with your intention on different parts of your feet. Many of my clients who have experienced discomfort in their feet also tend to step on their heel and go immediately to the great toe, the first long toe, and the ball of the foot behind the big toe. And this eliminates the capacity of the full use of the foot in really supporting your structure, your posture, your strength, agility, and balance in walking. So keep your focus on towards the outside of your foot, not your fifth toe, but more towards the third and the fourth toe, pressing and releasing through that part of the ball of your foot. Notice if you tend to lift your toes off the floor or curl them down into the floor. And just see if you can keep your toes more relaxed. And feel that influence up into your hips, your pelvic floor, your abdomen and your low back. And then switch over to the big toe, the ball of your foot that's right behind the big toe, and press. Really feeling that. Can you feel the difference between pressing through that part of your foot and closer to the outside, the third and fourth toe area? What does your foot want to do? And how does the rest of your body respond? For many folks, accessing the use of more towards the outside of the foot is very unfamiliar. So the question is, do you want to explore the unfamiliar, since it might be beneficial to have an option, or would you rather stay with the familiar even though it may be leading to some of your discomfort? One of my Feldenkrais teachers started our week-long workshop out by saying, with each of your clients, you have to ask yourself this: does this person really want to change because this is powerful work? Or do they just want to be more comfortable being how they are? Change can be frightening and liberating. So again, roll onto your side, same side please. And just play with some of these foot and leg movements. Try maybe raising your toe and then your knee and then your foot. Just randomly find places to play with. And in addition to noticing how you raise a body part up towards the ceiling, really notice how you lower it back down, How do you come to rest? Do you come to rest fully? Is there an underlying anxiousness to start the next movement? Before you finish one movement, are you already thinking about how to prepare the next one? Or can you fully stay present for the process of lifting, lowering, and resting one part before bringing your attention fully to the next part? And as with anything, we're training your attention, because how often do we stay fully attentive to one activity? If I have a list of things to do, when I get to the first place, to the grocery store, am I really at the grocery store experiencing the nice people and the wonderful choices that I have in the aisles? Or am I already thinking about the quickest, most efficient way to get to the office or the post office or one of my patients' house? And again, as you're lifting different parts, feeling the influence all the way through your pelvis and your trunk. Notice how the lower side, the side that is resting on the floor, is feeling supported. How does that side press into the floor in an effective way, a useful way to allow a body part to move? What an amazing organism we live in. We do so many of these things unconsciously, which is a gift, unless the unconscious pattern that we're using is contributing to discomfort, inability to do certain activities. And then next time you're raising your knee up to the ceiling, just keep going and going and going, and roll onto your backs again, please. Feel the right leg and the left leg. Feel the right side of your buttocks and hips and the left side. Feel how you rest in the sand now. Is it changing? How your low back arches away from the floor. The weight and length of your right and left legs. The pressure of the back of your heels on the floor. And then again, one leg at a time, bend your legs up. And bring your attention to the leg that has been the top leg. The leg that has been doing the moving when you've been on your side. And just a few times, press and release through that leg. Feel just the one-sided pressure. Feel where you get your support from through your foot. Which part of your foot do you automatically access first? And then play around with that a little bit, really feeling the influence and the differences between pressing through your heel, through the outside of the ball of your foot, the inside. And what's it like to really press through the whole foot so the weight is distributed evenly? In yoga, they actually talk about 4 points, either side of the heel, the outside of the ball of the foot, and the inside. Can you find those 4 points and connect evenly through your whole foot? Or, if you can't, just notice where you can't. Is that okay with you? Is it okay with you that you've gotten to this point so far to have various asymmetries, imbalances that may or may not be working for you? Because until you can be okay with how you are right now, it's very difficult to change. It's very difficult to beat yourself into submission. But if you can be okay, and more okay, and more okay, be curious, be interested, compassionately exploring who you are and how you are in the movements of your body, change will come, change will happen, and you will feel better. So after you've explored that right foot a few times, the foot that was on top a few times, rest it, and then shift to the opposite foot. Just begin the exploration, pressing and releasing through the opposite foot. And noticing, what part of your foot do you use? And then roll on to the opposite side, please. Bending your hips at 90 degrees and your knees at 90 degrees. Letting your top leg be fully supported by your bottom leg. And begin the explorations wherever you want to. And just do your best at practicing staying fully with a lifting, a lowering, and a resting before going to the next body part. And you can start anywhere. You can start with your knees, your feet, your heels, the ball of your foot. But just be with the movement. Feel as much of yourself, how much of your whole body participates in that movement in any one moment. What's different about this side? As you got more and more familiar with moving body parts on the opposite side, how does this side feel different now? And how far up your body can you feel this? How does your pelvis move? Forward and back, up and down? And if there's movement in your pelvis, what's happening in your spine, your trunk, your head, your breathing? And notice if you go into a sequence where it's maybe the ball of the foot, the heel, the knee, the foot. Do you fall into a sequence, or is it random? Is it fun to just pick one different each time? And practice sticking with it, noticing that your mind wanders and starts preparing the next one. And being okay with the tenacity of the mind. And again, next time you're raising one knee away from the other, just keep it going all the way onto your backs, please. And rest for a moment, legs long or knees bent, whichever is most comfortable. And just feel what sensations are really alive for you right now. What's really interesting? What do you notice? Is it differences that are interesting? Softening that's interesting? Are you curious what it's going to feel like with the next movements or when you get to stand up? And one last time, please bend your knees up and put your feet on the floor. And a few times, the most recent foot that was on top, bring your attention to that foot and just begin pressing and releasing and noticing which part of your foot is the dominant part. Where do you send most of the pressure through? And then beginning to play around with that, shifting from pressing through your heel, through the whole of the ball of your foot, to the outside, the inside. Each time giving yourself permission to see if you can experience some new sensation, something new and interesting that occurs with the shifting of something as subtle as the pressure through the bottom of your feet. Such little changes can make such big differences. Really. And then rest that foot for a moment. And a few last times, just press with both feet and relax. And stay with the movement. Stay with the pressure translating all the way up through your trunk, your spine, your neck and head. And stay with the full release of the movement. Where do you let go of pressure? Once you've engaged the pressure through the bottom of your feet, how do you release that pressure? What is it that's letting go? And how do you feel that letting go through your whole system? And how fully do you go? How fully do you let yourself really go into the release, the relaxation? Many people are familiar with contract, relax exercises. So as you press, it's like contracting. And as you release, you can just let everything go into the warm, sandy beach. And when you're ready, roll to your sides and come up to sitting and standing. Walk around and see what comes to your attention. What's alive for you? What kind of lesson was this for you? For some of you, it might seem like a foot lesson, but others of you might feel taller or wider or lighter or more grounded. So be with your new sensations and try to carry them through the week with you, and enjoy your day. Thank you.